Hi, my name is Sarah Powers. I am a MSN student in the Psychiatric Mental Health Nurse Practitioner program at Eastern Kentucky University. Today I will be doing an integrative review presentation on substance use disorder. The purpose of this integrative review is to answer my PICO question, which was in adult patients diagnosed with substance use disorder, how does group therapy compared to non-group therapy affect the rehabilitation and recovery from substance use disorder? Substance use disorder is the abuse of things like opioids, stimulants, alcohol, and marijuana. According to Healthy People 2030, the goal is to increase substance use treatment, the goal being 14%. According to the National Survey on Drug Use and Health 2019, there are 39.1% of people aged 18 to 25 that have used illicit drugs in the past year. 39.7 million people aged 26 and older have used drugs in the past year. Roughly 70,000 drug overdose deaths happen annually. Less than 2% of people that have a substance use disorder actually seek treatment, and 32.9% of Americans also have co-occurring mental illnesses. The federal budget for drug control in 2020 was $35 billion. In this integrative review, I will be going over 3 studies that will help answer my PICO question. The first study was a level 1 meta-analysis review. This study was performed by Coco et al. 2019. And this study was systematically reviewed to provide estimates on the efficacy of group therapy for substance use disorder. The studies compared the intervention group, which was group therapy, and control group, which was no treatment, individual psychotherapy, and medication only, dependent variable being substance use abstinence. Data was collected based on the inclusion criteria from 7,873 records on the type of therapy, how many sessions were completed, the length of the sessions, and at the end, follow-up was conducted on abstinence from substance use disorder. The findings from this study showed significant effects of group therapy on abstinence in each comparison group of no treatment, individual therapy, or other treatments. These results were based on self-reporting. The second study was a randomized controlled trial, level 2. This study was done by Azkosh et al. 2016. The objective of this study was to compare the effectiveness of group therapy versus non-group therapy on the psychological well-being of individuals with substance use disorder, currently in addiction treatment. The dependent variable being the psychological well-being after group therapy was performed. The study took place in an inpatient rehabilitation facility. 60 patients were placed in randomly in 3 groups of 20. The first group received the intervention, which was group therapy. The second group worked the 12-step Narcotic Anonymous, and the third group, which was the control group, received their maintenance dose of methadone only. The 18-item psychological Welling scale, the AAQR 19-item scale, and the Likert scale was used to identify the psychological well-being of patients after group therapy was performed. The findings of this randomized controlled trial revealed significant positive effects of group therapy treatment versus non-group therapy. The difference between the groups was p greater than 0.05. Lastly, a qualitative review level 6 was found. This qualitative review was conducted by Gold et al. This qualitative review looked at the effects of psychosocial intervention, such as integrated group therapy on bipolar disorder and substance use disorder. The inclusion criteria for this study was patients with a bipolar disorder diagnosis and comorbid substance use disorder diagnosis. The integrated group therapy involved 20 60-minute weekly sessions. These group therapy sessions concentrated on topics such as identifying triggers, relationships with family and friends, and medication adherence. Participants receiving integrated group therapy were evaluated before starting the session, monthly after sessions started, and then 3 months after the sessions ended. Patients receiving integrative group therapy displayed superior improvements for their substance use disorder. IGT did not appear to change the outcomes of those with bipolar disorder. Having this knowledge allows the advanced nurse practitioner to interact more positively with the patients and gives the patients other treatment options that could prove more beneficial in the end for their substance use disorder. All 3 of these studies had a positive correlation with group therapy and the rehabilitation and recovery from substance use disorder. Group therapy is also shown to be cost effective and should be used in the treatment of substance use disorder. As a psychiatric mental health nurse practitioner, it will be important to develop good relationships with therapists within the facility you work and also out in the community. This would help place patients that are coming to you for a substance use disorder. It will help place them into a group therapy that will help them along with other therapies and medications. And I think that is the end of my integrative group review. Thank you very much.